Hi, everybody. Welcome to Research Updates with Leslyn. I'm Leslyn Keith. I'm with Lipedema Simplified and Lipedema Project. I'm the Director of Research and President of the Board. And I like to get together with you twice a month to talk about and review recent papers, something in the last couple of years about that has something that is of concern to lipedema, and sometimes even it's a study on lipedema. So I think I have another really good paper for you today. But I want you to observe that my email is right there, leslyn@lipedemaproject.org. Be sure to email me if you have any questions or comments. Of course, put your comments in right here. I love to know who's here and who's listening, and even where you are in the world. So be sure to put something in the chat and post stuff in the comments. And but if you have any questions about the paper that I'm reviewing today, or if you have other papers you would like me to look at, be sure to email me, leslyn@lipedemaproject.org. Also, if you're having a hard time getting your own copy of the paper I'm talking about today, I do have it, and I can send it to you as a PDF. So we'll be putting a link down below, so you should be able to get it. But if not, be sure to email me. I always look forward to hearing from all of you. And thank you. Someone from Georgia is listening in. Thanks. Nice to have you here. So let me tell you about the paper that I wanted to talk to you about today. It is called Lymphatic Improvement After Suction-Assisted Lipectomy in a Lipedema Patient. And this was out of a group of surgeons who wrote this paper. They're out of Sao Paulo, Brazil, and they published the paper in Plastic and Reconstructive Surgery Global Open. It just came out in June of 2023. So anytime something has lipedema in the title and it's something very, very recent, of course, I'm drawn to it and I check this one out. I think you'll find it interesting too. So the aim of this study was to look at the impact on the lymphatic system after liposuction for lipedema. So, and so before I go into this particular study, let me just do a couple of definitions for you in case you're not too familiar with some of the terms that they might have used. The first one is the name of the procedure that they used in this study, tumescent suction-assisted lipectomy, or SAL, it looked like they're using that acronym in the paper. And so this is a surgical removal of subcutaneous fat by means of using a cannula that's introduced into small slits in the skin, and they suction out the fat tissue using that. And it is said in the literature that this is said to preserve the superficial lymphatics. So, and then another thing that they mentioned in the study that they used was lymphoscintigraphy. And not all of you may be familiar with this imaging technique, but it is a radioactive tracer that they inject just below the skin, between the toes or between the fingers. And this generates an image that they can see where does the lymph fluid travel and how quickly can it get to the regional nodes. So it gives us some good information about lymphatic functioning. And the last term I just wanted to make sure that you knew what this was Stemmer's sign. And so Stemmer's sign is a test that we do typically on people who have lymphedema, and you are trying to pinch and lift the skin right at the base of the toes or right at the base of the fingers on the back of the hand or on the dorsum of the foot. And if it's positive, the skin is so thickened, there's edema present and skin changes present that you cannot lift the skin at those locations. So that's a Stemmer sign that's positive. If you have no difficulty in lifting the skin, that means that they're negative for a Stemmer sign. So let's look at what's the methods that they use for this study. And this is interesting. It was a case study. So there's just one person involved in this study. And this is a great place to start. It's almost like proof of concept. And now maybe we can go on to a larger group. So they used one single person And she was a woman diagnosed with lipedema, and they wanted to look at the impact of suction-assisted lipectomy, or SAL, on someone who has lipedema, on their lymphatics. And so not only did she have the procedure, though, she also had post-operative treatments that included MLE, compression therapy. I think she used some pain medication, stuff like that. So it wasn't just the liposuction technique, but also the post-operative things that they did. So a little bit of information about that single patient. She was a 34-year-old woman who presented with symptoms that were consistent with having lipedema, including she had the bilateral enlargement of her legs and arms. She had discomfort. She had a feeling of heaviness, and she had frequent spontaneous bruising. So we know these are all characteristics that are consistent with a diagnosis of lipedema. And previously, she had gone through many non-invasive treatments, as many of you have also done. So that included, she had dietary restrictions, she did manual lymph drainage, she did regular physical exercise, she had made many weight loss attempts, and she only had a very mild response to each of these. And she also reported that her symptoms of lipedema started around puberty, and this is the most common lifetime phase where lipedema seems to appear. And it had gotten gradually worse since then, so showed some kind of progression. So the data that they collected, they, of course, got her age and weight, and they also did a complete preoperative and postoperative assessment. And they looked at all of her symptoms and how severe each of those were. So they looked at the volume of her arms and legs, they looked at her pain levels, they looked at the bruising, and they looked at swelling or edema. And then, of course, they also did a lymphoscintigraphy. That's that imaging technique. And they did that prior to having the suction-assisted lipectomy, and also 9 months after the procedure was done. And so the results were, as I already told you, she's 34 years old. Her weight was 96 kilograms, and that's 212 pounds. And then preoperative, the assessment, it's said, as I said, she was presented with a significant enlargement of her arms and legs, especially the thighs and knees. Her forearms, hands, and feet were unaffected. There was no clinical evidence of any edema. And her stemmer sign, as we discussed, was negative. Then the lymphoscintigraphy that they did, it showed evidence of slowed lymph transport in the left leg and normal speed in the right leg. And interestingly, then also the right leg had what's called tortuous lymphatic vessels, meaning that they weren't streamlined and straight. It seemed to have a non-streamlined pathway. So post-operatively, what did we get? Well, she definitely had post-operative pain. They didn't report what her level of pain was preoperatively, but for the first 3 weeks post-op, she had moderate pain, but it completely resolved within 3 weeks. And then she wore compression bandages 24/7 around the clock for the first month. And then she transitioned to compression garments. She only wore those for a half day at a time. And then after 6 months post-op, interestingly, she was able to stop wearing compression garments altogether. That's interesting. And that may be because they didn't notice any swelling prior to surgery. And so the compression they used after surgery was dealing with post-op swelling and not a pathology. So that's interesting. So no compression after 6 months. And then 9 months after, they, of course, repeated the lymphoscintigraphy, and it showed a complete resolution of those lymphatic abnormalities that we talked about, and it had normal transport time in both legs. Very interesting. And so what are their conclusions? Well, they say that this is the first study that was actually looking at the impact on lymphatic function of getting a liposuction surgery for someone who has lipedema. They said that multiple studies have shown that there is benefits to lipedema symptoms with liposuction, and they all say that it is preserving or protecting the lymphatics. But this is the first one that actually looked at to see if the lymphatics were indeed protected. And the authors say that they feel like not only in this case study was were the lymphatics protected, but they actually showed improved function after having the liposuction procedure. And so then they went on to say that they hypothesized that there was a couple of different mechanisms that may have been responsible for this improvement in this patient. And so one is an inflammatory environment. So if there's inflammation, it impairs lymphatic functioning, and it can slow that repair and regeneration after you've had a procedure. And so they said that multiple studies have shown that liposuction, post-liposuction for someone with lipedema, we have decreased inflammatory markers in the tissue. So if you had elevated IL-6 or some other inflammatory marker prior to your liposuction, typically you had decreased inflammatory markers after liposuction. Therefore, the authors suggest that we're getting a decreased inflammatory environment, and this is likely helps with lymphatic function. It helps with lymphatic healing. So I think that that's probably, decreased inflammation when you don't need the inflammation is probably good for a variety of systems and structures. And then the other thing that they talked about, another possible mechanism of why this works so well for this particular patient, was obesity has been shown to impair lymphatic function in other studies. And it's hypothesized that obesity can lead to lymphatic injury. It can increase inflammation, as we already talked about, and that can further impair the lymphatic function, actually just due to the overgrowth of fat tissue. So they hypothesized by removing the excess fat tissue that we are decreasing the inflammatory environment, but we're also interrupting this vicious cycle with inflammation and obesity. Interestingly, because other studies have shown that when we have obesity, we have a lot of times stagnant lymphatic fluid, and stagnant lymphatic fluid itself can cause the proliferation of more fat. And so it's almost like the fat breeds more fluid, which breeds more fat. And so it's this vicious cycle. And so they are suggesting that maybe another mechanism of why this procedure helps with lipedema is that we're removing that excessive and possibly diseased fat. We're interrupting that cycle that just causes everything to snowball. And so now we're allowing better lymphatic function. We're allowing those lymphatics to actually heal. So interesting hypothesis and a very interesting paper. I would say that this paper, even though it is just on one individual patient, it contributes to our knowledge. It's a great place to start. This is very promising in this one person. It's proof of concept. Now let's go out and get a larger sample size and see if indeed we have improved lymphatic function in a larger sample of women with lipedema undergoing liposuction surgery. I think it is also important to show that this patient who participated in this case study, she did a non-invasive approach first and tried to see what she can get from that. And she also did non-invasive measures after the surgery to promote really good healing and improved outcomes of her surgery. So I think that it also demonstrates that doing a liposuction for lipedema is not standalone. It's not like this is one magic procedure you can do, and then you don't have to do anything else to manage your lipedema. It's very important to really look at it holistically and see, how else can I support functioning health in other measures, other interventions. So Very interesting paper. And like I say, you can contact me if you have difficulty getting the paper, because I would love to share this with you and see what your comments are. I'm looking over now in the comments that you guys have. Juanetta says, hi, it's sunny and 67 in Anchorage. Lovely to hear that. Marilee is also in the Pacific Northwest. Nice to have you here. And Leslie asks, what's the difference between sol and wall? Okay, and posted right here, interesting case. Okay, put that one back up. We got it. Okay. Leslie wants to know the difference between sol and wall. Great question. I am not particularly sure, because I'm not really up on all the surgical procedures. There are a lot of different ways to do liposuction, and several different methods are being used for lipedema. I think the most important thing is that you, when you consult with a surgeon, that you know that that surgeon has a clear understanding of lipedema and experience with lipedema, and what is going to be the best surgery procedure for you. And so talking with a lot of people to find out what's going to be the best. I'm sorry, I don't know in particular what's the difference between those two surgeries. And then let's see. Jerry says, interesting case study, would like to see a larger study too. Yes, this is a great place to start. And I think it's fabulous that the authors published, this is what we saw in this one person. Let's all of us look at this more. We're not going to all look at it more until you publish that single case study. So that was good. And Juanetta agrees that it's critical that we do conservative both before and after surgery. I agree completely. Becky says, yes, even after surgery, we have to keep doing everything we're doing before. Yes, it doesn't mean that you get to stop doing all that. Unfortunately, you still got to really take care of your. And then Becky says that WAL stands for water-assisted liposuction. And this other one that they were talking was also using water, I believe, as well. But it also, it didn't use general anesthesia. It just used local anesthesia. I think that was introduced with the cannula. But I'm not entirely sure, because I'm not, like I say, I'm not really super up on the surgeries. Yeah. Okay. And Juanetta just says that suction-assisted lipectomy is suction-assisted using an ultrasound probe. Oh, how interesting. So maybe the ultrasound is helping you figure out where you're supposed to go. I'm not entirely sure, but I do believe that I heard in a presentation by Dr. Stefan Rapprich, who really started doing liposuction procedures for lipedema in Germany. He does prefer that there is water in this procedure. So, okay, so I have a couple of announcements for you as well. We are having a free webinar this coming Thursday. It is August 24th, Thursday. Your body is talking to you. Please listen. Could it be lipedema? And this is a free webinar with Catherine Seo and Lisa Dwari. It is, I think, going to be a fabulous webinar, and really looking at really the whole spectrum of a woman's life, including her professional life, including the younger woman with lipedema, as well as the older woman with lipedema. So it's looking really at that whole spectrum, and how can you pause and listen to what your body may be trying to tell you. So there's a link for information and to register below. And even if you cannot be there for when it's being aired live, remember, just by registering, you will get the replay. So you will still have the benefit of that webinar, even if you can't attend. And then I'd also like to just tell you to save the date. Of course, we're having our next heart-to-heart event in October, the 27th, 28th, and 29th. We have a fabulous lineup of experts, but remember, this event is interactive. It really needs you to be run really well, because we are all experts. We all have something to share. We have all some support to give to each other. So be sure and look at the link and register, find out more, join us and be there with us. It's going to be 3 days of action-packed, wonderful information and collaboration, and being able to talk to your peers and experts in the field. So I hope you can join us for that. And so with that, I'm just about ready to wrap up for today. I just want to see if I've missed any other comments here with people that are joining me here today. We got someone else here from joining us from Arizona. Thanks for being here. And so if you have a paper you would like me to review, or if you have trouble accessing this paper, be sure and email me, leslyn@lymphedemaproject.org, and I'll be joining you again on the 3rd Thursday of the month. Oh, that's already today. So it's going to be the 1st Thursday of September. So just after Labor Day weekend here in the US. So I will see you again next time. Thank you so much for joining me here today. And